Let's take care of our children. COVID-19 cases per day have increased from the period of June to August 2021. The increase in cases in the years 0 to 9 years old is at 74%, and from the 10 to 19 years old at 60%. Special considerations for the pediatric population. So, the DOH recommends prevent, detect, isolate, treat, reintegrate. Children 2 years of age or older and their accompanying adult should wear a mask when outside their home. Wearing of mask is not recommended for the following: children younger than 2 years old if the child has difficulty breathing when wearing it, children with cognitive or respiratory impairment if the mask is a possible choking or strangulation hazard, if wearing a mask causes a child to touch their face more frequently, in cases where children cannot tolerate masks, face shields may be an alternative but does not offer equivalent protection. The DOH recommends that COVID-19 testing may be done for these children. Specific techniques may be used to ensure a child is calm during testing and using the same test for the adult and the pedia. So anong test ang pwedeng gamitin? Ito yung RT-PCR test and the antigen test. Now, moving on to isolate and treat. If symptoms are mild, it's best to consult via telemedicine. Pediatric COVID cases that are asymptomatic with mild or moderate symptoms cleared by doctors may be managed at home as long as there is individual room and bathroom and regularly monitored by the doctor and the local government unit. In case of facility isolation or quarantine, pediatric patients should be accompanied by an adult family member or relative. Same as adults, for symptomatic patients with mild symptoms, 10 days from symptom onset, plus 24 hours clinically recovered and no symptoms. On pediatric vaccination, the recommendations from all the experts groups say, do not yet vaccinate the pediatric population at this time. Protection is cocoon strategy and vaccinating the vulnerable adults that will protect our children and general population. Vaccine alone will not stop transmission. On booster vaccination, do not yet vaccinate booster at this time. Pediatricians in various groups urge the government to ramp up vaccinations among adults to protect children against COVID-19, as there is a growing concern that the highly contagious Delta variant is more fatal for children. The call came from the Philippine Pediatric Society and the Pediatric Infectious Disease Society of the Philippines last August 12 in a forum titled COVID-19 in Children. So let's remember this. Hashtag apat dapat pa rin. A is for air circulation and ventilation. Iwas mga kulob na lugar. P, physical distancing. Iwas sa matataong lugar. A, always use face mask and face shield. T, time of interaction. Mas maikli, mas maganda. Kung kayang iwasang magpagkita sa ibang tao, iwasan. So, apat, dapat pa rin. Now, do you need a free consult on COVID-19? You can check out PGH Telegabay at facebook.com/pghgabay. You can chat with volunteer doctors from UP, the University of the Philippines at the Philippine General Hospital every 8 a.m. to 12 noon, 2 p.m. to 6 p.m. daily. So, please take care, stay safe. Stay safe because you protect your community.